Distinguished board members, I appreciate the opportunity to speak. I am with the Canadian Drug Policy Coalition, a non-partisan organisation working to advance drug policy grounded in evidence, public health, human rights and social justice. We work with dozens of civil society organisations across Canada and beyond. We envision a world where all people, regardless of their relationship to drugs, can access safety and well-being. I'm speaking from Ottawa, the capital of Canada, which occupies the traditional unsurrendered territory of the Indigenous Anishinaabe Algonquin Nation. Today, Canada is experiencing a drug policy crisis because of drug laws first created more than a century ago. Canada's drug laws, which helped shape the current international drug regime, are rooted in Eurocentric, colonial, racist, and classist ideals. These laws were not based on evidence of health concerns, but were designed to control and exclude particular cultures and communities, many now most impacted by the global war on drugs. An unintended but inevitable consequence of the current international drug control conventions has been the expansion and diversification of novel, often more potent drugs. In just a couple of decades, Canada's illegal opioid supply has shifted significantly. Heroin has almost entirely been replaced by other drugs. As drug suppliers started finding heroin harder to produce and transport, fentanyl became a preferred substitute. Fentanyl is not inherently dangerous. It is used widely in human medicine. But because of its potency, a small difference in the amount of fentanyl can kill. And in the unregulated drug market, dosage and purity are never assured. As unregulated fentanyl displaced heroin, deaths started to increase. The opioid supply was no longer contaminated by fentanyl, it was fentanyl. Then, as we targeted illicit fentanyl production, we started seeing different fentanyl analogs. As we have increasingly targeted fentanyl precursors, we have seen the introduction of other substances. People are now consuming drugs that unknowingly contain multiple substances, often including illicit benzodiazepines and nitazene-type compounds, adding to health concerns. If international drug control conventions were intended to protect the health and welfare of humankind, then they have failed. In Canada, and increasingly elsewhere, they have driven the diversification of drugs, in turn causing unprecedented mortality, negative health outcomes, and other social impacts. In a country of 40 million people, each day 22 Canadians are killed by unregulated drugs. In 7 years, over 40,000 have died. A group called Mums Stop the Harm, mothers who have lost children to preventable drug deaths, now has over 4,000 members. Beyond the deaths, there are huge strains on our emergency and healthcare systems. There are thousands of hospitalizations, a growing cohort of people surviving with brain damage after non-fatal overdoses, and traditional opioid therapies such as methadone are less effective. There is persistent grief and loss in communities. There is a desperate need for novel responses and innovative solutions. We need to provide more holistic prevention, but we will never stop all people from using drugs. We need to improve access to voluntary, evidence-based drug treatment, but not all people will need or will benefit from treatment. We need to scale up harm reduction supports and address our housing crisis, but instead we are spending huge amounts of money on prohibition and drug enforcement that are making the situation worse. For many years, people who use drugs have expressed the need for a stable, predictable, and accessible supply of regulated drugs to prevent many of the acute harms we currently see. One approach has been the small-scale implementation of safer supply programs, providing pharmaceutical-grade drugs as alternatives to the illicit market. A recent scoping review published in the International Journal of Drug Policy indicates opioid safer supply programs produce a range of benefits, including reductions in opioid toxicity deaths and unregulated opioid use, improved access to healthcare, and reduced engagement in drug procurement activities such as low-level crime and transactional sex. Current medical models use regulated health professionals to prescribe existing pharmaceutical drugs and fill a gap in the continuum of care for a small number of people who use drugs. But they are limiting because not everyone can access healthcare or a medical prescriber, and not everyone has a diagnosable substance use disorder. Alternate models such as community-based compassion clubs are needed. As well, drugs that can currently be prescribed in Canada do not always make for suitable replacements due to dosage and formulation. For example, many prescribed drugs cannot be smoked, which has now become the most common route of administration. Ensuring access to these essential prescribed medications, expanding the types of prescribed and non-prescribed regulated drugs available, and looking at alternate non-medical models of access such as compassion clubs is critical. Safe supply programs could have significant positive impacts if supported and scaled adequately, but there are numerous domestic and international policy barriers which limit their implementation. Pathways for exemptions to Canada's Controlled Drugs and Substances Act and international drug control conventions are needed to enable programs and ongoing evaluation to inform new models. We need to regulate rather than prohibit the production of drugs. This would greatly reduce the risk of overdose and other health consequences. Regulation could also significantly impact environmental concerns from the current illicit production of drugs and aid in sustainable development by working with farmers, growers, and industry. Significant resources currently used for the enforcement could be put towards prevention and sustainable development initiatives that will in turn reduce overall demand for drugs. Futile prohibition strategies have not stopped people using drugs and have only worsened the global drug situation, and continued supply-side enforcement-focused interventions will only deepen the crisis. We need and can change course. A new paradigm is not simply for the health of people who use drugs, but critical for racial and social justice, gender equity, human rights, environmental protection, and the realization of the UN Sustainable Development Goals. Thank you for your attention.